Hello, learners. Let's learn about epistaxis or nose bleeding. Epistaxis or nose bleeding. The definition: a hemorrhage from the nose, referred to as epistaxis, is caused by the rupture of tiny distended vessels in the mucous membrane of any area of the nose. Nose is situated in a vulnerable position as it protrudes on the face. It has very rich blood supply with both external and internal carotid system, various arteries and veins, and vasculature just runs under the mucosa. Exposed to any kind of drying effect immediately causes nosebleeds. There are various causes of nose bleeding. It could be local causes or it could be general and systemic causes. Trauma, infection, violent sneezing, neoplasm in the nasal cavity and surroundings do come under local causes. Under general and systemic causes, we have blood diseases, hypertension, acute infectious fever, and high altitudes. The different types of nose bleeding: anterior epistaxis being the first type and posterior epistaxis being the second type. Anterior epistaxis is more common, happens in the little's area or anterior part of lateral wall. Very common in children and young adults, mostly caused due to trauma. It could be mild and can be easily controlled by local pressure or anterior pack. But posterior epistaxis is less common, frequent in people above 40 years of age, happens in the posterior superior part of nasal cavity. It's spontaneous and may be due to hypertension or anterior sclerosis. The bleeding can be severe, may require hospitalization, and post-nasal pack is often required. How do we stop the common nosebleed? As shown in the picture, one can lean forward slightly with the head tilted forward. Spit out any blood collected in your mouth and throat. Gently blow any blood clots out of your nose. Pinch all the soft parts of the nose together between the thumb and index finger. Breathe through your mouth as you do this. Hold the nose for at least 5 minutes. Repeat as necessary until the nose has stopped bleeding. Sit quietly, keeping the head higher than the level of the heart. Do not lay flat or put your head between your legs. Apply ice wrapped in a towel to nose and cheeks afterwards. Stuffing nose or tissue into your nose is not recommended. How do we prevent nosebleeds? When the air is dry, try to apply nasal saline spray. Use it every 2 to 3 hours while awake. Or apply a cool mist humidifier to humidify your room at night while you're asleep. Coat the inside of your nostril with Vaseline or saline nasal gel 2 times a day, especially at night. You can also place a cotton ball coated with Vaseline in the affected nostril overnight. Thank you, everybody. Have a safe day.